at least 4 people have died after contracting a severe respiratory illness that has spread to more than 40 states, public health officials announced on Wednesday. The deaths were the first to be linked to the nationwide outbreak of Enterovirus 68, which has caused an influx of sick children, some of them critically ill, at hospitals around the country. The Centers for Disease Control and Prevention confirmed 472 cases of the infection as of Wednesday, although experts said the true number of cases was likely to be many times that number. Tests showed that 4 patients who died had been carrying the virus, but it was unclear to what extent the virus contributed to their deaths, the C.D.C. said. One of them was a 10-year-old girl from Cumberland, RI. Her parents took her to a hospital last week because she had difficulty breathing and symptoms of a common cold. Within 24 hours of being admitted she began to deteriorate rapidly, and she died a short time later, said Dr. Michael Fine, the director of the state's health department. Very quickly after they got to the hospital, things became dire, he said. Dr. Fine said the girl was believed to have died from the combined effects of a bacterial infection, Staphylococcus or sepsis, and Enterovirus 68. The combination is exceedingly rare, and causes severe sickness in children and adults. The C.D.C. did not disclose details about the other deaths. The first cases of enterovirus were reported in August at Children's Mercy Hospital in Kansas City, Mo. The infection typically causes fever, coughing and other intense symptoms that resemble those of a bad cold. Some children, particularly those with asthma, can develop breathing problems that require emergency treatment. Federal officials are also investigating reports of paralysis or muscle weakness and other polio-like symptoms in a small number of children, some of whom tested positive for Enterovirus 68. Before the current outbreak, Enterovirus 68 had been linked to cases of sudden-onset paralysis in California. On Wednesday, Senator Barbara Boxer, Democrat of California, sent a letter to the National Institutes of Health asking whether the agency was working to develop vaccines or treatments for the infection. "We already know that D68 is extremely dangerous to our children, particularly those with asthma and pre-existing respiratory conditions," Ms. Boxer wrote, using an alternate name for Enterovirus 68. Parents are wondering what more can be done to prevent their children from being infected. At Children's Mercy Hospital in Kansas City, where the outbreak struck hard and early, Dr. Mary Ann Jackson said that she and her colleagues had treated about 850 children suspected of having the infection. 3 of those children are being monitored closely because they are showing polio-like symptoms, but enterovirus has not been confirmed in those cases. Dr. Jackson said that cases of the infection there peaked in early September, hit a plateau and were now falling very slowly. "Based on what I am seeing here," she said, "I suspect that at least in my community, we're going to be out of enterovirus season soon, and we want to be seeing it by the end of the month."